Hi, my name is Mary Beth. This is a nursing administration presentation taking a deeper look in technology in healthcare. With the advancement in technology, it is important for nurses, specifically those of us in leadership, to be aware of technology and use it to help improve our patients' quality of care. Highland Hospital is affiliated with Strong Memorial Hospital and is a part of the URMC umbrella. During this presentation, I will be looking deeper into some technologies used to improve patient outcomes at Highland Hospital, focusing on the operating room. Donna is the Director of Information Management. She works for the University of Rochester Medical Center, covering Strong, Highland, and FF Thompson. Donna covers the revenue cycles, health information management, and utilization management throughout URMC organizations. She has been through the entire transition to EHR in URMC and is currently overseeing the FF Thompson Go Live. The choice to use eRecord as an EHR for URMC was a big decision, and Donna had a huge part in this. The selection team identified that eRecord had many positive aspects surrounding clinical documentation, which is one of the reasons why it was chosen as URMC's EHR program. Currently, Donna's department is working towards transitioning all patients to one medical record number. She referred to this as an E number. Historically, they have had a different number for each facility, making things very complicated and compromising patient identification. Her department is also working on the use of a new feature in eRecord called OneNote. OneNote is allowing patients to access notes written by their provider about their care. Donna's office gets over 450 requests per day for medical records. It's her team's job to ensure the medical records released are compliant with HIPAA. The Health Information Department employs nurses who review patient charts and documentation for quality surrounding reimbursement for services. Sue Simeone is the Highland Hospital informatics nurse. Sue considers herself an administrative leader and nursing advocate surrounding technology and the electronic health record. Her position prior to Highland's Go Live, she described as a clinical architect for eRecord. Since the Go Live, her position has evolved. Currently, her main role is to advocate for a nursing workflow, educate and support staff with technology changes, assisting in rollouts of new processes surrounding technology. An example she discussed was the recently rolled out intravenous pump Alaris integration at Highland. These intravenous pumps work with the electronic health record. The system allows nurses to scan the patients to their IV pump at the bedside, automatically uploading orders. Nurses are no longer entering them manually, and this is improving patient care by reducing medication errors. These smart pumps offer immediate access to patient information by associating the patient and the device along with the medication orders. Sue was involved in this transition and offered support and education to the nursing staff throughout the learning curve. The use of the Alaris integration is an example of using data sets to improve healthcare. These pumps fit into big data category called machine to machine, uploading the data pump to the EHR. Shana Held is the HIPAA Privacy Officer at Highland Hospital and Highland Family Medicine. She is responsible to conduct chart audits, do staff education surrounding patient privacy and HIPAA, address confidentiality violations and concerns, and answer any questions from patient or staff. Shauna spends lots of her time meeting with various professionals in healthcare. She attends nurse manager meetings once a month. She has regular meetings scheduled with privacy officers at the local hospitals, and she meets with human resources very often. At Highland Hospital, eRecord is the only form of electronic health record used. Information technology in healthcare continues to grow and develop across the globe. At Highland Hospital, we have an electronic health record with real-time documentation for patient care, including inpatient, outpatient, and surgical patients, among others. MyChart is available through the EHR to help patients have accessibility to their health care, allowing them to participate and encouraging patients to take charge of their own care. OneNote is a fairly new part of our EHR at Highland Hospital, allowing patients to view notes written by their provider. This may give them a refresher about what they spoke to the doctor about, and again, giving patients more awareness and ownership of their care. Equipment at Highland Hospital advances every day. The SPY Elite, the Bear Hugger, and the Alaris integration are examples of pieces of equipment used in the Highland Hospital operating room. Databases are also a huge part of informatics and technology at Highland Hospital. Data can create knowledge in organizations, leading to learning, and then it can be used to address questions about costs, risks, and benefits of interventions being done in practice. RL Solutions and Sensitrack are examples of databases used daily in the operating room at Highland Hospital. The electronic health record went live at Highland Hospital in 2011. It has been a complicated yet beneficial transition. In the operating room, we went live with OpTime in 2014. The following slides dive deeper into the EHR at Highland Hospital. The beginning of eRecord was in 2008, and it was built between 2008 and 2011. Many people were involved, including Donna Barnard and Sue Simeone, who were mentioned previously because I interviewed them for this project. eRecord went live in sections. First inpatient care, then ambulatory care, followed by OpTime, ICD-10 codes, and billing. The most recent go live is the FF Thompson transition to eRecord. The FF Thompson, they did the entire system at the same time, all care areas, ICD-10 codes, and billing. Donna explained the history of eRecord surrounding URMC in her interview, and Sue discussed how improvement is a continuing opportunity. Some of the roadblocks encountered during the FF Thompson Go Live have highlighted differences in practice between facilities. Having the same EHR means streamlining practice throughout each facility. Sue has a lot to do with this, as differences often come from nursing practice. Having consistency throughout healthcare facilities will only improve patient care. Electronic health records have improved the quality of patient care in healthcare organizations. EHR collects data. It can identify trends, eliminate guesswork, and lessen human error by flagging high doses of medication or drug interactions, all while increasing time and efficiency across the board. In a study done by Schuyler et al., it is concluded that after the implementation of EHR, nurses spend more time at patients' bedside performing nursing interventions, along with improved time and efficiency. There is an opportunity for nurses to spend more time on care coordination, working towards a lower readmission rate. Highland Hospital's annual report from 2017 shows an increase in our HCAHPS scores surrounding discharge planning, along with a decrease in readmission rates. These scores have gradually improved since eRecord was implemented, and healthcare professionals have become more proficient in its use. As discussed in the previous slide, there are many benefits to an EHR. eRecord specifically thrives in the clinical aspect of EHR. One of the reasons eRecord was chosen for URMC is because of its proficiency in the clinical aspects and the ability to share information across many healthcare settings, for example, inpatient versus outpatient. Other positives highlighted by Shana Held, the HH Privacy Officer, include easy ways to document, the simplicity of reaching information, and the way eRecord stores and maintains information. Some of the negatives surrounding eRecord include easy access for employees to view inappropriate information, lack of restrictions, and sometimes there's a difficulty trying to extract data from eRecord. Donna Bard mentioned that the billing part of eRecord can be complicated, and they are still trying to work out all the kinks surrounding this. As I mentioned before, Shana feels the accessibility to eRecord is too simple, but employees are trained in HIPAA and about patient confidentiality. It is the responsibility of an employee to protect patient privacy. When there is a known breach in privacy, Shana identifies it, investigates it, and then hands the information to Human Resources, allowing them to interview any employee that was involved and determine appropriate action. This chart here is simple and can give you just some tidbits on how to protect yourself and your patients surrounding patient privacy and confidentiality. Use your work email. When discussing any patient care, it should not go through personal emails. Call, don't text. Patient information should never be in a text unless your device is encrypted. Keep your devices secure. If you have your work email on your cell phone, you need to make sure it's password protected. Minimize your risk and protect your patients. The next section of this presentation focuses on 4 technology innovations in the operating room at Highland Hospital. Bear Hugger is the brand name used at Highland Hospital. The machine is also known as a forced air warming system, a thermal regulating system, and a forced air warmer. It is used during surgery to regulate a patient's temperature. The Bear Hugger is the original forced air warming system and has become an essential nursing intervention in surgical care across the globe. According to the FDA, use of any thermal regulation during surgery has been shown to lead to a decrease in postoperative infection, less bleeding throughout the procedure, and a faster recovery time for patients. Nurses are a patient's biggest advocate during surgery. During surgery, the use of a Bear Hugger is a nursing intervention and it helps maintain patients' thermal regulation and should be used unless contraindicated. At Highland, we use the Bear Hugger blanket on the majority of our surgical patients. Recently at Highland, we have started initiating use of a Bear Hugger on the patient in the pre-surgical screening unit. This improves patient satisfaction and thermal regulation prior to surgery. A C-arm is an imaging device that utilizes X-ray technology to help with visualization in diagnostics in the operating room and in clinics. It is a C-shape. It connects the X-ray source and the X-ray detector to one another. A C-arm is easy to maneuver around the operating room table and offers clear images that are needed intraoperatively. The purpose of the item is to offer visualization during interventional procedures and offer general surgical imaging. A visible image is displayed on the C-arm monitor that allows the doctors to check anatomical details at any time. X-ray is the oldest form of imaging and has been around since the turn of the century. X-ray continues to develop and improve, making it increasingly useful in healthcare. By utilizing a C-arm in the OR, it can increase the success of various surgeries, including orthopedics, neurosurgery, urology, and vascular surgery. Orthopedics is one of the heaviest users of C-arm in the OR at Highland Hospital. Their volumes have increased by 18% in the last year, so our use of C-arms has also increased. A C-arm is essential for many orthopedic surgeries, allowing surgeons and nurses to visualize a fracture or a surgical implant to verify placement. Highland is a joint center of excellence. In the last few years, anterior hips have become a common practice, offering patients a smaller incision, decreased dislocation rate, and decreased hospital stay, and more efficient recovery. In an anterior hip, a C-arm is an essential piece of equipment. Because of the approach and the short incision, surgeons rely on pictures from the C-arm to place the implants. A C-arm can be used routinely, like I mentioned, but it can also be used in the OR unexpectedly for care during an intraoperative complication like a fracture or a miscount. The robot is a complex tool used to perform minimally invasive surgery. At Highland, the robot is used primarily for gynecology, urology, general, colorectal, and oncology procedures. The robotic surgical technique was first introduced in the 1980s with aim to improve disadvantages of traditional laparoscopic surgery. The popularity of robotic surgery has increased in the last few years due to the development of the articulating instruments and improved views. The robot enhances ergonomics and improves the view of anatomy, allowing the surgeon to access and operate on hard-to-reach places. This table shows the increase in the Da Vinci surgery performed at Sloan Kettering in New York City, and it's quite amazing that from 2003 to 2016, there's that big of a difference in the amount of procedures done with the Da Vinci robot. The Da Vinci is used at Highland Hospital in ORs 8 and 94. When scheduling these cases, it is imperative for the entire surgical team to be involved, ensuring that the correct equipment is available. The robot demands a complex setup and requires adjustments to the normal surgical workflow. The robot console monitors the robot itself, proper surgical bed, and all the appropriate instrumentation are examples of specialized equipment needed for each robotic surgery. The preparation of the OR is the responsibility of the OR nurse and the surgical technician on the robotics team. It is important that they have extensive training and education prior to working with the robot. Although there is a complicated setup and some risks when using the robot, it is felt that the advantages outweigh the disadvantages. Some improved patient outcomes include decreased length of stay, reduced complication rates, improved outcomes, and a faster recovery time. The handheld knee navigation system is used at Highland Hospital in total knee replacements. It was developed to eliminate possible human error while making bone cuts and preparing the knee for implants in a total knee replacement. Misalignment of implants can cause postoperative complications. There is an absence of conclusive evidence to determine that the results of the knee navigation in a total knee are superior to those not in a computer-assisted knee. However, accuracy of alignment cannot be ignored. More research needs to be done to determine the cost versus value of the use of the knee navigation, but the handheld computer-assisted surgical device has a lower cost than the robotic version, which may lead to more research. At Highland, the handheld computer-assisted device is typically used by newer surgeons because they are more familiar with it from their training. Currently, it is used for select patients that may have an increased risk for post-surgical complications. The use of the computer-assisted surgical knee navigation device improves alignment of a total knee, likely improving patient outcomes. The device takes the variability out of the total knee replacement, making the process straightforward, therefore decreasing the risk of error from anyone on the surgical team. During a computer-assisted total knee, there are less components for nursing staff to use, freeing up their time to focus on their patient during surgery. Technology has always been at the forefront of healthcare. Currently, nursing informatics and the use of an electronic health record is being integrated into healthcare at a rapid rate. Highland Hospital continues to improve patient care and roll out innovative technology in our everyday practices. This presentation has offered many advantages surrounding technology and has explained how they are implemented and used at Highland Hospital. A nurse leader is at the forefront of patient care. Managing nurses directly at the bedside, we have a unique opportunity to make immediate difference for a patient. The combination of strong, informed leaders with technology will result in the success of Highland Hospital and continue to support our model to provide patient family-centered care. The opportunity to learn about informatics and healthcare, then look specifically at Highland Hospital, where I work, has given me a new outlook on technology and nursing leadership. I was honestly uninterested prior to class about technology and informatics, but learning about the value it offers and the impact I can have as a nurse has motivated me to learn more. Nurses are experts in direct care, being the healthcare professional with the most face time with patients. It's our job to remain up to date and support the growth in informatics and technology in our practice. Here are my references. Thanks for your time. I hope you learned as much as I did.